ahead, we'll go ahead. Kindly allow all the participants to join. Do we have everyone from the CAHO secretariat, please?
Not sure, ma'am.
Sakshi, can you put up a message asking everyone to quickly join? We'll start in the next 2 minutes.
Good evening, Dr. Lallu.
Good evening, Dr. Sir.
Then you can start with the anthem.
Yeah. No, I think we'll just start with a small intro.
Okay.
Yeah, I think we'll go ahead and start. Very good evening, everyone. Request all of you to kindly mute. Let's start with a smile. Today marks a proud milestone as CAHO enters its 13th year, a remarkable journey of togetherness dedicated to advancing healthcare quality and patient safety across India. What began as a very small mission, I would say a small initiative, has truly evolved into a nationwide movement driven by passion, collaboration, and commitment. Let's begin our celebration with the CAHO anthem.
A new dawn, a new horizon of healthcare delivery and patient safety. We have a goal, a noble drive.
Hand in hand, step by step, we will thrive.
To march ahead together for a bright and shiny future with patient safety and quality healthcare. We are CAHO, your healthcare companion. Standing right by your side. Joining hands for building a vision, shaping a culture for patient safety.
Setting up standards with best foot forward. Won't ever leave no stone unturned.
We wear our pride on our sleeves, walk with passion like a breeze, training people, enhancing their skills, spreading the message of quality healthcare for safer patient care, a better nation.
We have a goal,
We have a goal,
a noble drive.
noble drive. Hand in hand, step by step, we will thrive. To march ahead together for a bright and shiny future with patient safety and quality healthcare. We are CAHO, your healthcare companion, standing right by your side.
13 years of togetherness is something to celebrate. We have grown leaps and bounds, and let's hear from our President Emeritus about the journey so far of collaboration, networking, bringing people together, and an amazing journey together. Over to you, Vijay sir.
So, good morning, good afternoon, good evening, depends upon which part of the country you are joining us from, my dear CAHO family. 13 years. Let that sink in for a moment. And I think this is one of the most difficult jobs that I'm having today, to talk at the completion of this 13th year or 13th birthday. Like what Lallu said, 13 years ago, a handful of people had joined together to really bring the accredited hospitals together to promote their journey of continuous quality. And it was a very simple kind of a vision, I will say, statement. However, as we started growing, we realized that the main purpose of accreditation had been to reduce medical errors and to promote patient safety. And looking at the entire example of the world over, we realized that if this organization has to do something, it has to make accreditation more meaningful, more impactful. And that's where our journey started, to starting training quality implementers in the country, both basic and advanced, and numerous other training programs for the capacity building, with the whole idea that the accreditation should not be just a snapshot or a 1 day particular or 5 days event, but every hospital should be ready for accreditation every single day. And for that, a huge amount of capacity building and a huge amount of work is needed. So much so that with all those training programs and everything, our yearly events, that CAHOCon and Diagnosticon, they have become not like any other conference. They are like a mega family event of all the quality in just, I will say. Over a period of time, our focus started reach that if we have to make a difference, then we have to reach out to everybody. And that is where we started looking at that all these segments. So whether it is individuals, or it is the diagnostic people in the hospital, or it is the pharmacy. So we started creating these forums. And the idea of those forums was that they have to look at what are the adverse events, what are the wrong things which may be happening in their area, what are the good practices that they need to focus on. And therefore, in small, small blocks, they need to look at the empathy, they have to look at the communication, they have to look at how technology can be adopted in that area, how sustainability can be practiced in that area. So slowly and gradually, I'll say that we became another alternative voice to the accreditation. This alternative voice is not an adversary. It is absolutely complementary to the accreditation system, so as to that every hospital, every healthcare organization has to be moved towards becoming a reliability organization. Declaration of our last CAHOCon to be the first South Asia regional conference of ISQA was a testimony to the fact that probably CAHO is becoming the India's voice in the area of global arena. India's voice of patient safety is being represented by CAHO. So I would say that what began 13 years ago, our governing committee was probably just about 10 individuals. Today we have more than 250 plus, I think 270. And that's what is the kind of strength. Our secretariat started with one part-time person. He's on the flight today, otherwise he would have joined. From Delhi. And today we have 25 plus people who are the backbone And I can tell you, whether it is the secretariat or of course our governing committee members, the kind of passion, the kind of with a missionary zeal with which each person has been working to promote patient safety and quality has been just absolutely phenomenal. I will say that talking about on this thing, our other events, we started very early in our life. We realized the technology, the importance that it is going to make in transforming healthcare. And that's where our first CAHO Tech was organized in 2016. 11th annual conference will happen this year on the 14th and 15th of November at AMTSET. And hopefully we are going to see. We started catching, I will say, hospital administration students very young. And that's where we started SECON. And that has also become a very vibrant kind of an annual conference. And the 5th annual conference, I think this year will be at Amity in near Noida in the National Capital Region. So the growth of CAHO has been because of, I'll say, collaboration with the healthcare institutions, collaboration with industry, collaboration with academic institutions. And this collaboration has really given wings to not only to CAHO, but to the whole concept of patient safety, and so much so that I will say that today we can say that CAHO is not an organization, it is a movement. It is a movement representing patient safety. Our investment in research is also paying dividends. I think last year, 17 publications in reputed international journals can do proud to any organization. I'm not taking even names of all the people who have been kind of responsible for bringing us right from the beginning till this age, because if I was to do that, I think the whole 1 hour is needed just to enumerate those names and the people. So everybody, right from our patrons to governing committees, to the various project leads, to the program directors, each one of you. And I'll say that 2 areas which have been very crucial in trying to go further and promoting patient safety. The 2 very areas is, one is the patient's voice and other is getting clinicians on board. And I must say that getting the patient's voice, our Patients for Patient Safety initiative, which has now become a Patients for Patient Safety Foundation, is another very vibrant kind of a body which is reaching out to lakhs of citizens every week. Our reach out to clinicians, that has been the most stumbling block all over the world. But I think our relationship and association with the societies of emergency medicine, critical care, and anesthesiology is, I would say, a great step forward to say that we can try to reach out to the other specialty organizations to make an impact on the issue of patient safety. I can also say one thing, that all where we have reached here is not because of any particular head office or a kind of a central area, etc. It's because of each one of you. So at the end, I will just like to say one thing, and that is thank you. Thank you for being a part of this beautiful journey. And I will say, like I see as the pattern of leadership is so beautifully being kind of is going into much more vibrant hands, but most important is the contribution going to be from each one of us. each one of us have to continue to devote ourselves. And I can tell you one thing, this issue of patient safety is something I quote, it is for, I think, more than 2,500 years, because Hippocrates talked about first do no harm. So he must have seen harm at that time. And even WHO is again talking about the same issues today also. So we will continue to talk about those harm unless or until we are, I think, able to do what we are doing through CAHO, and that is to reach out to everybody. So thank you very much. And very soon you will see the glimpse of what CAHO has been doing. Thank you.
Thank you. Thank you so much, Vijay sir. I will quickly take you through what we have done last year. Good evening, everyone, dear patrons, governing committee members, healthcare leaders, partners, faculty, members, students, and the entire CAHO family. We have named it the Quality Promotion Day. We started this activity last year, and it gives me immense pleasure as President of CAHO to welcome all of you as we celebrate the 13th Foundation Day of the Consortium of Accredited Healthcare Organizations. We wish to place on record the contributions of Dr. Vijay Aggarwal in strengthening this organization. As sir said, 13 years ago, CAHO started with a very simple but powerful vision to improve healthcare quality and patient safety in India through collaboration, learning, and sharing of best practices. Today, we are proud to see CAHO grow into one of India's leading healthcare quality movements, bringing together healthcare institutions, diagnostic centers, professionals, academia, industry partners, patient safety advocates on one common platform. Over the years, CAHO has worked continuously through strengthening healthcare systems. We strongly believe that healthcare improves when people learn together, work together, and grow together. Thousands of healthcare professionals, nurses, students, experts, administrators participated in all our activities across the country and abroad. We are very proud that today we have 260 governing committee members, 17 active forums, 7 committees, 4 major divisions, and 49 centers of quality promotion. These platforms are helping us take quality education, leadership development, and best practices to every part of the country. The year 2025-26 has been very, very special and important year for CAHO. We launched several new initiatives, training programs, and in particular, our faculty development program at the Anapoya Institute, and we are extremely proud of what we have done together as an organization. As we celebrate this important milestone today, I would like to sincerely place on record our appreciation to our dear patrons who are here, the governing committee members, faculty, volunteers, industry supporters, students, and every member of the fraternity for their trust, dedication, and contribution to this journey. CAHO belongs to all of you. It is indeed a movement. And on this 13th Foundation Day, let us once again reaffirm our shared mission to work together for safer healthcare systems, better patient outcomes, continuous learning, and to create a stronger culture of quality across India and beyond. Thank you everyone for joining and wishing the entire CAHO family a very happy 13th Foundation Day. Kudos to all of you. Let's celebrate together. So let's start with listening to our patrons. As always, patrons of CAHO, the pillar of what we do. We have 6 important people here with us. So let's begin by listening to them on their vision, how they started, and where we are and where we should be going. Let me first ask Dr. Gyani, the patron of CAHO and the pillar, I must say, of the CAHO movement. Gyani sir, CAHO has completed 13 years of its journey. In your view, what has been the most impactful contribution of CAHO to healthcare quality and patient safety in India?
You see, because we started the NABH, and I remember the initial days, were so tough because convincing hospitals to take accreditation, and it was a very, very tough journey. And we started few consulting organizations, and the kind of work they did help us, but nothing reached on the ground. So in my opinion, if I want to talk on ground, Actually, this is a CAHO which has really made the accreditation journey so effective in our country, because the kind of program which CAHO launched, the implementer, this is the concept of all of you have been talking about implementer, which actually really, made a huge impact, 4 days course, initial, then advanced course, these people who actually they really understood quality from the grassroots or from the fundamentals, I will say, and they implemented that across the hospitals. So that is the way I'm saying that Dr. Vijay was talking as a alternative movement. I think this is the only way I disagree with him. It is not alternative. You are the main. In fact, you are the main propagator of quality, because NABH is not the main. They are only the certifier or accreditor, but CAHO is the main, body which has promoted quality. But one or two things, because in 2 minutes I can only mention few things, let me tell you here, which has really made, if I look at the CAHO, it has grown larger than the life, We normally talk about Amitabh Bachchan has grown larger than the life, and things like I think I can see CAHO as a larger than life kind of organization, because the few things which has impressed me is, for example, the 17 forums. I don't know whether you realize it or not. Actually, you have made the quality as a owners among these 17 forums, which nobody thought about it. Quality was thought about administrator, few clinician, few nurses. But when we created these forums, I think this has made a huge impact, because the ownership of quality has gone now across. That is number one. Pre-conferences workshop. I tell you, I am amazed, to see the kind of response which we get. The whole city, wherever we organize CAHOCon, becomes galvanized, Actually, 13, 14, this time I think it was 20 plus workshop, and each workshop is having 100 plus delegates. I can't imagine now how it has impacted, because we have made the quality as a journey of joy. It is not, the people earlier used to talk as a painful exercise. Arey, accreditation karna hai, my God, this and that. But I think the way we have gone across, it has become a journey of joy. And that's why people have taken the ownership of quality. This time when I saw a few books which was released at Chennai, I tell you, this was another milestone. My God, that kind of publication. In fact, now the time has come. You take another 2 years now and make a publication of the journey of the CAHO. Because people should not forget about how the CAHO has really, this should become a case study across. So take 1.5 years when we talk about 15th year, it should be released a journey of the CAHO in our country. I think all the best. Actually, there is still, let me tell you, Lallu, you should not get complacent. There is still too much to be done, and sky is the limit. And this, finally, bringing best quality from globe. Nobody could think that a organization like CAHO, which is not NABH in fact, can bring the international bodies in our fold. And we are not learning from them. I can say it very openly. In fact, we are making them to learn from us. So that is something wonderful, wonderful to remember how we have completed 13 years. All the best. Over to
Thank
Lallu
you.
again.
Thank you, sir. We will never become complacent with patrons like you. Always there to support us, and you have given us the best of Secretary General now, Dr. Parag Rindani. Over to Parag.
So, thank you so much, Lalu. Thank you, Dr. Gyani, sir. I want to ask Dr. Alexander Thomas, who has been part of both the academic circles in terms of the ANBAI, as well as with Patients for Patient Safety through CAHO. We've been working together. Dr. Alex, what message would you like to share with young healthcare professionals as well as future quality leaders on the occasion of CAHO Foundation Day, sir? So over to you.
Yeah, thank you. Thank you, Parag. First of all, congratulations to the CAHO family. 13 impactful years. I think the journey has been, the growth has been phenomenal. I still remember when we started, at one point I was wondering, have we made a mistake? Because there was hardly anybody joining us. But then over the years, we were able to get started, and I think it's been taken to a totally different
level. And today we have become nationally respected and globally recognized movement in healthcare and quality. And also you see all young governments in Tamil Nadu, young ministers in Kerala and Calcutta. But much before that, the younger leadership emerging across the different parts of the CAHO had already started this. And I think if you look at it today, young professionals are leading, innovating, and collaborating meaningfully through CAHO. Your governing board is probably one of the youngest governing boards I've seen. And it has demonstrated to our country and to the global healthcare community what can be achieved through leadership, sincerity, passion, commitment, and integrity. These are not, having been in this field for a long time, these don't come easy. But I think CAHO has been able to get a group of people who are totally committed to it. And also, what is especially encouraging is that young leadership in healthcare quality and patient safety is from all. You're not focused on the metros. You're not focused on north, south, across the country. So this movement has become relevant, inclusive, and future ready. My message to the youngsters, having worked in Anbai, in CAHO, in HPI, it's simple. Quality no longer is an additional responsibility. I think we all realize this because quality is CAHO. It's the very foundation of good healthcare. Patient safety, ethics, communication, compassion, and teamwork must become part of everyday practice. And I think that is what CAHO is promoting. The future of healthcare depends not only on technology, but also on our ability to build trust, reduce errors, improve systems, and deliver humane and patient-centered care. So the younger generation, to all of you, the youngsters, I encourage you to lead with integrity. I think that is something that we have to keep on underlining. Integrity, integrity, integrity. Yes, innovation is there, but we also need to look at humility and empathy. We have the opportunity, and I'm not exaggerating, India has the opportunity to build one of the finest healthcare systems. We know we have so many advantages, and the youngsters and CAHO will play a defining role in shaping that future. And in this, my concluding statement is, in this age of technology and artificial intelligence, we must not forget compassion, empathy, the human touch. The human touch is absolutely essential. My congratulations to all of you. You've done a wonderful job, the governing body, to Lallu, to Vijay, to Parag. All the best and God bless. And we wish you all the best and let's take it to the next level. Thank you once again.
Thank you, Dr. Alex. Lallu?
Parag, carry on.
Okay. My next question is to Dr. Thuppil, sir. Dr. Thuppil, sir, also called very popularly the lead man of India. As a patron of CAHO, how do you see the organization evolving in the coming years to further strengthen healthcare systems and patient care? I think your views are important for us, sir. Dr. Thuppil joining us all the way from the US, sir.
Thank you, my dear Parag, my dear secretary. I tell you, CAHO has entered teenage last year. We are teens, and CAHO is nothing like a child prodigy. When you look at the achievement CAHO has done, it is much more than the child prodigy. The future is very bright. You asked me a very relevant question. What I would like to tell you here, in addition to our other patrons mentioned, Dr. Gyani elaborated, Dr. Alexander Thomas highlighted the commitment, passion, and empathy, sympathy, all that. I tell you, when you said what is the future, what will be our commitment, we are still a teenager. We are going to become adults. What are our responsibilities will increase. CAHO can always achieve. I have very high confidence in every CAHOite. You know, we are going into predictive digital twins. You must be aware of this digital preventive twins for population health to prevent crisis and allocate resources sustainably. Allocation of resources, if it is sustainable, then we will achieve universal health coverage, you know. And apart from that, we also have energy efficient, transparent AI to automate administrative waste. AI is going to help us a lot, for example, for billing, authorization. And so we can free up staff for patient care. And apart from that, we are going to get into open and affordable artificial intelligence standards so small and rural organization can adopt interoperable solutions without vendor lock-in and closing equity gaps. The future is not just healthcare in urbanized area where 80% of the people live. It is in the rural area we need to focus. I'm sure our CAHO as teenagers, as adults will take the projects in a very brisk way without getting tired into the Indian rural system. And one more thing I would like to add, as earlier mentioned by our emeritus. What is that? We have to be the global leader. We are already, I tell you. We have to be global teacher. We are already. We have to be, advocate globally. Normally, we used to say think globally, advocate locally. But I have changed it. Perform locally, what CAHO is doing, perform locally and advocate globally. We can educate globe. We can be another international body stronger than any other international healthcare organization today. I am extremely delighted to be part of CAHO from day one. I am extremely delighted to be part of every one of you, wherever I am, whether I am in Bolivia, whether I am in US or in India. My heart always beats for CAHO. CAHO is our very, very dear central nervous system for the entire healthcare across the globe. And especially with teens like you, Lallu, and our team, it is not the team, teenagers. I tell you, we have a very bright future. I can see from 50 years from now where we are going to stand. We will be developing standards for healthcare. We will be developing implementation technology. We will be the leaders globally. And I wish you, every one of you, the wonderful, mischievous, productive teenage to be completed in another 6 years, and then become more responsible adults to shoulder all the healthcare responsibilities and become advisors to respective states, governments in respective countries. Thank you very much.
Thank you so much, Dr. Thuppil. And over to Dr. Pawan Kapoor. Sir, as you know, collaboration has been one of CAHO's key strengths. How important, according to you, is collaborative learning and knowledge sharing in transforming healthcare today? Dr. Kapoor, sir.
Yeah, thank you, Parag. Firstly, good evening, everyone. Secondly, I think happy Founders Day to come. You have asked me a question which has already been responded to very lot in details by my predecessors who have already spoken about it. I know CAHO from the time Dr. Alex was there and Dr. Aarti were there, who were carrying the torch. And now I see that this torch has ignited so many lives over the past 13 years. So I think hats off to CAHO. And how did CAHO do it? The CAHO did not do it by individuals. CAHO did it by collaboration. CAHO transformed over the last 13 years by collaborating, by learning from each other, by sharing knowledge. And that's how CAHO has become what it is. And all my seniors here, they know how CAHO reached there. The only thing that can transform any organization, it cannot be in silos. We cannot have silos and islands of excellence. It has to be through collaboration. And that is what CAHO has shown us. Collaboration with international organizations, collaboration with various professional associations, collaboration with like-minded agencies, collaboration with various engineering departments, because healthcare cannot be seen in isolation as only the domain of the medical professional, healthcare professionals. Healthcare is a domain of multiple, it has got multiple domains. And CAHO has shown that these domains, once they come together, how it expands does not multiply by arithmetic progression. It actually grows by geometric progression. And that is what CAHO has done. And that is the only way healthcare can be transformed. We say, that if you share sorrows, they become halved. If you share happiness, it becomes doubled. But if you share knowledge and learnings, they quadruple. It is not only affect those who are sharing, it goes to several more people at the same point of time. What CAHO has done to transform CAHO into such a vibrating, dynamic organization is because of this collaboration. And in my opinion, collaboration, sharing of knowledge, sharing of experiences is the only way forward for transforming healthcare from its present state to the future state where the patient will be not seen as system-based patient, but as a holistic patient, which will help us to eliminate errors, which will help us to promote quality, which will help us more dynamically involved with patient and community care, and which will help us to take healthcare to the next level. Simply by talking and speaking is not the way the CAHO has moved forward. It has put in concepts from a lot of people, lot of leaders. They brought in programs, they brought in training in which everybody was involved, irrespective of his status. It was more important what was his knowledge at that level. It may be anybody. It may be a junior most person. It may be the senior most person. But everybody could come together and share, starting from young professionals to not so young, and to those who are now reached the pinnacle of their incompetence. Okay, that's where I place myself. We all learn from each other, and that is what CAHO did, and that is the future for healthcare. CAHO has shown the way, and that is how I think healthcare is going to be, that transforming healthcare to is the next level of excellence is only possible through collaboration and sharing knowledge. So thank you for the opportunity. I wish each and every member of CAHO all the very best. You have been amazing. You have been wonderful. You have done selflessly contributed to the cause of healthcare in this country. And I wish and pray that this organization grows from strength to strength and scales heights that are possibly not possible by any other organization, not only in this country, but across the globe. So thank you very much. Jai Hind.
Thank you so much, Dr. Kapoor. Lalu, over to you for taking things forward.
Thank you. Thank you so much, dear patrons, and truly appreciate you taking your time and joining us. Now we'll move on to the next part of our celebration, which is celebrating the future healers. This is the Future Healers Forum. We have a partnership with Aster DM, and we are really grateful to them for joining hands with CAHO. We have two of our students who finished the Quality Olympiad, the MBA hospital administration students at Dubai now, as part of the CAHO Aster DM Healthcare Facility International Student Exchange Program. They will be joining us now, sharing their experiences, learning, and empowerment. Our thanks to Dr. Malti Arsanapalli and Dr. Nisha Nair for initiating this. And I hand over to Mr. Kogul Bharat first, and then Dr. Hemant Gowda. Kogul?
Yes, ma'am. Can I share my screen?
Yeah. Yes, please. Very short, 3 minutes. Thank you.
Yes. Hello, everyone, and congratulations to the CAHO team for this 13 years journey. And I would like to express my gratitude towards CAHO and Aster team for initiating this international student exchange program. So I am Kogul Bharat, and I have completed my MBA in hospital administration from Indian Institute of Management, Jammu. And I'm also proud to say that I'm a student of Air Marshal Dr. Pawan Kapoor. So we had a set of tasks that was given by both, that was formulated by both CAHO and the Aster team. So I had to work on a quality improvement project. I worked on complaints of TVT assessment and prophylaxis administration. So this project was mainly on improving the documentation process and also to improve the complaints towards TVT administration. And we had to work on root cause analysis and CAPA. And we worked on SOPs and understanding PREMs and PROMs and tracking of KPIs and KPI validation, how they perform their KPIs and how they present the KPIs to the clinical governance team. And we also worked on FMEA, failure mode effect analysis. So the clinical and academic exposure that we got is we got a very good exposure of international JCA standards. For about 1 week, Dr. Malati gave us lectures about JCA standards and the policies and frameworks. And the key learnings that we got is we learned how to deep dive into root cause analysis of any incidents that happen within the organization, within the hospital, and how to come up with the CAPA and discuss with other stakeholders, and also initiate a preventive actions. The academic and professional contributions that we gave is we worked on the project and presented in the clinical governance meeting, and we were able to provide a interpretation, and post interpretation we found some improvement in the results. Professional exposure. So we were able to discuss with all the stakeholders, such as the doctors, nurses, and regarding any root causes or coming up with the CAPA. And when we worked on the projects, we got a lot of help from the doctors, nurses, and also my quality team in Aster. And cultural exposure is that since it is an international internship, we had the opportunity to interact with people and doctors from different countries, different stakeholders, and we did we tried to understand patient satisfaction. We try to know more about the people from different background and who has different sentimental beliefs. So through this internship, I developed more confidence in discussing about my findings about my project to all the stakeholders. It helped me increase my interest towards healthcare quality. So hospital quality is not just about collecting data; it is also about bringing about a better change in the organization as well. So I got a deeper understanding of how root cause analysis is done, how CAPA is done, how a project is done, how the data should be presented in the meeting, and how to do post analysis and everything. That's it, Ma.
Thank you. Thank you so much, Kobul. Request Dr. Hemant Gowda to please.
Lalu, I have to say something.
Yes, sir.
Okay. Now, Kobul Bharat has been my student in IIM Jammu. He was doing this. He had taken total quality management in healthcare as a separate subject. Okay.
Yes, sir.
Komal, you have done me proud. Very nicely, you have actually implemented on ground the root cause analysis and the failure mode effect analysis that we discussed in the classroom. So very well done. This is just the first few steps to success that you have taken. My blessings and good wishes are with you. You have already outlived my expectations. Thank you very much, Kogul Bharat.
Thank you so much.
Thank you so much.
Thank you, sir.
Thanks a lot. And your institution is very proud of you, Kobul. We met up with your director yesterday at IIM Jammu. Thank you so much for
Thank you.
best wishes to you. Dr. Hemant Gowda, please. Dr. Hemant Gowda?
Yeah, can I share my screen right now?
Yes, please. 3 minutes.
Hope my screen is shared.
It is. Go ahead.
Greetings, everyone. Firstly, happy Founders Day to CAHO. So I was part of the batch 1 of internship program with CAHO and Aster DM Healthcare. So I'm Dr. Hemant. Currently, I'm pursuing my MD Hospital Administration from Kasturba Medical College. So I must thank CAHO and Aster for this wonderful opportunity, sir. So I'll just brief through my 3 months of learning with Aster and CAHO internship. So my major project was based on dental services across all Aster clinics. So in total, Aster has 24 dental clinics. So I was allotted these clinics to carry out various quality initiatives. And with this, we had other projects on root cause analysis, mapping of scope of services, then FMEA matrix on patient workflow, and a pilot study on trauma and root canal treatment. So just to outline one project which was executed during this 3-month internship. It was on clinical audit and quality improvement of dental documentation and patient education practices with respect to dental services and in compliance with DHA guidelines. So this project was about auditing the patient file documentation. So roughly around 200 files were audited using an in-house audit checklist and considering parameters in compliance with DHA guidelines. And post audit, the main quality initiatives carried out is training and awareness modules for all our healthcare professionals with respect to documentation. And the next quality initiative was on patient education. So for patient education, we came up with posters for displays at our dental clinic and post-procedure specific education material. These are the two major initiatives which were carried out. And this post-procedure education material was more of a QR code which can be placed on the consultant's desk so that patients are well aware about the post-procedure care. And when it comes to the learning part of this internship program, I must say this was very well and multicultural healthcare environment exposure for myself. Had interaction with the multidisciplinary team, had a very good understanding of international healthcare standards, and then had an hands-on experience in real-world quality initiatives like RP, SMU, CAHO, and this was indeed a very good learning opportunity for myself. And with this, this had a very much profound impact on my professional growth, and the key takeaways being enhanced improvement and patient safety skills, hands-on experience in analytical and problem-solving abilities, which strengthened my leadership and teamwork skills, particularly with respect to attending meetings on teams. So this was one such first exposure for me. So that has also been a great learning for me. And I must say I've gained confidence in audits, reporting, and presentation, and developed a very good understanding of regulatory compliances and patient-centered care. Thank you very much. Thank you, CAHO and Astro, for this wonderful opportunity. And I must thank Dr. Maliki and Dr. Nisa for coordinating the entire process. Thank you very much. Thank you, everyone.
Thank you, Dr. Hemant. Thanks a lot for the presentation. Indeed, the next batch is ready to go to Dubai, and the Astra team is coordinating that. The team of 3 young professionals will be reaching Dubai next month. Thanks for the help, Astra DM. And now we started another program this year, which is the Fellowship in Clinical Governance. When we started this program and when Dr. Rahul Deshmukh and Dr. Vasundhara initiated, of course, all of us sat together and developed the program. We didn't expect this kind of a response from clinicians across the country. So today I invite 2 professionals who completed the Fellowship in Clinical Governance. The second batch is going on with 100 participants and 17 from other countries. So Dr. Nita Jo D'Souza and Dr. Ajay Sashidhar to present their experience on empowering healthcare professionals, your perspective on clinical governance. Dr. Nita?
Yes, ma'am, I'm here.
Go ahead, Dr. Nita.
Yes, I'm just sharing my presentation. Am I audible?
You are.
Yes, thank you for this opportunity to share my personal experience with the Fellowship in Clinical Governance. At the outset, I would like to congratulate you all for the 13th Foundation Day. And I was really inspired by Dr. Rahul Deshmukh, who has been a mentor and our guide, our course director for the fellowship. So just sharing my experience with regards to it was new to me that it was a process or a system where the organizations are accountable for continuous improvement of the quality of the services and, of course, ensuring high standards of patient care and creating a very facilitative environment. Now, considering what was the key learning experience, this again was a broadening of my perspective and understanding that there is a comprehensive, and it really transformed my experience in terms of just resorting to traditional academic training. It made me more adaptive to integrating principles of the healthcare quality, as well as understanding that it is multidisciplinary, that it involves not only clinicians that I personally thought, but of course, a major role of administrators, educators, as well as quality professionals. And this order actually brought a very broader perspective on my understanding of the healthcare delivery system and what actually makes it work. I would say the modules were very structured. It enabled us to go through a lot of case discussions that were personal experience of many of the participants. It gave us time to critically think and reflect on existing systems, practices, and how we could make a change. It also highlighted an important shift from individual clinical performance, which mine was, to understanding how healthcare system influences outcome, safety, as well as quality. So if I tell you about the practical aspect, knowing to put patients first, that we definitely do, improving the standards of working, which not much thought has gone into, learning from our experience, from shared experience, enabling staff and team, which often is not done, which again was a wonderful insight, use information effectively, the key elements being accountability, transparency, as well as patient safety. So what I understood was that it ensures that anyone who passes through the healthcare system is well cared for. The staff is given definitely empowered, enables the staff to work in the best possible way, as well as the highest possible standards. So now, considering that I am a senior anesthesiologist, so how was it important to me? For me, the thought was more of a managerial obligation. But what I realized is it definitely it helped me personally, in sense it was a structural scaffolding that protects patients, my practice, as well as professional integrity. So it helped my understanding that it is a continuous quality improvement with safeguarding standards and upholding standards. So it translated into a set of daily, departmental, and career-long responsibilities, and the impact is to stay. Now, ultimately, how the craft of anesthesia becomes an accountable profession was, in fact, this was an eye-opener for me. So in anesthesia, we often see there's an invisibility of failure. There are many adverse events which are hardly reported. We miss tracking them. There is time pressure because of the urgency of doing things in a very systematic way and faster. Often there are misses, and the checklist definitely highlights the importance. Handover vulnerability is there. So it gave us certain norms or governance tools that we used. High stake procedures, regional techniques. It's not only that you just perform, but it has to be, the standards have to be upheld by doing regular audits, as well as having some registry. One more important aspect, what I felt, was regulatory bodies expect documented evidence. It even gave me an insight as to why documentation is important, why audits are important, why reflection over personal experience as well as shared experience is important. So it definitely, I would say, gives substantial professional and legal protection as well. It is, for me, like a leadership currency, like driving an APS audit, chairing a meeting with psychological safety, developing a regional block credentialing pathway, for example. It shapes the culture of the department that we run, and also the culture of the trainees that are training under you, and in ways that individual clinical excellence would not achieve solely. So these definitely, understanding clinical governance frameworks, it definitely helped me to understand, even with regards to patient safety principles. I wouldn't go into the details of this, but again, a lot of quality improvement methodologies using RCA, clinical audits, process mapping. These were definitely new to me, and I feel it played a very important role in me presenting an audit of the acute pain services at my hospital, and helped us improvise and go beyond understanding what we felt and were very complacent thinking systems are in place. So definitely the methodologies helped. Again, risk management. The importance of having risk management, reporting near misses, how do we mitigate risk, as well as proactive safety systems. Again, leadership and communication, definitely. As I said, interdisciplinary collaboration, team dynamics, it definitely gives you a better insight into how it would be helpful. Now, how did it impact my personal practice? Definitely with regards to protocol-based, which I definitely uphold. Patient safety awareness, reducing risk, in patient and using strategies appropriately. A lot of documentation, audit, and outcome. It's not a boring task, but it is very effective, and its application as well to critically evaluate healthcare processes. With regards to the institution, I felt the quality improvement initiative, sometimes there is a lack of awareness at the level of institution. So that definitely I helped encourage or bring insight into it towards overall development and revision of clinical protocols wherever relevant, conducting audits, making people realize the importance of having them, as well as discussions on patient safety with the teams. So data-driven decision-making and evidence-based organizational change was a personal experience and benefit. Practical takeaways are all this, just to emphasize, there were small improvements that I definitely made in my practice with regards to, even as I said, we performed the audit. We realized near misses also should be reported to avoid adverse events overall. Standardized checklist protocols, we definitely have it as a sign-in, timeout, and a sign-out, continuous audit and feedback. Now, what I realize is it's not just leadership is just not limited to administrative roles. We have to act through it, through setting examples as well as audits. Psychological safety, so my team has to feel safe to share their experiences, bring about near misses. Again, it brought a lot of insight into collaboration, communication, empowering my team, and having shared ownership. Now, reflecting, definitely this was an experience beyond clinical expertise, which I have, considering 18 to 19 years of experience. It definitely brought in insight as to if I need to be safe, effective, and consider high level of quality, it requires system thinking, accountability, as well as leadership, and something that makes us run it continuously with an aim to improve. And a framework for becoming a better clinician, but also more of an effective leader, just not a leader, but an effective leader advocating patient safety as well as healthcare quality. And what we actually got to do, we had better insight into clinical governance. We had interactive sessions. We cleared doubts. We had mentors. We even had guidance on our projects. We attended CAHO Con, which was definitely a huge, I think it was an ocean of, people interacting at a very different level. And of course, we got to interact with Professor Ezekiel, who was the ISPO president. And there was nothing like, there was no barrier with interaction. They were free to interact. And that was definitely an icing to our culmination of our FICG. And I plan to continue it as well, whatever I have gained.
Thank you so much, Dr.
you.
D'Souza. Thank you, Dr. D'Souza.
Truly appreciate Dr. Nita for your presentation. And we will listen to Dr. Ajay Sasidhar, consultant surgical oncologist from NS Memorial Institute. Over to you, sir.
Am I audible? Is my presentation visible?
Yes. Go ahead. Keep it very short.
Good evening. Myself, Dr. Ajay. I'm a surgical oncologist practicing in Kollam and Trivandrum. So I will just mention my journey from just healing the patient to healing the system. So like being in oncology, I was exposed to measuring this patient, our outcomes, because there is only very less margin of error in oncology. And if anything happens, it manifests as a tumor recurrence. And it is one of the most dreaded things in oncology, not just for the patient, but for surgeon also. So when I started my career, I started logging my cases also to see where I could have improved, or if anything happens, to retrospectively think whether I could improve for the next patient. So I always try to go along with the guidelines. So while visiting our old patients, I felt that even the best performed surgery may fail because of some situations which are not in our control. Maybe because of the post-operative care, or maybe because of the quality of the pathology report, which directs the adjuvant therapy, or even the timing of adjuvant treatment, or the communication with the patient regarding the adjuvant therapy. All these things matter ultimately for the outcome of the patient. So to improve, and I understood that even the best performed surgery can fail entirely. And so to improve the outcome, we must think outside the box, and we should try to improve the system. That's what I felt. So there is a need for a structured and continuous system was there. And continuous is a keyword because even the best running machine require some form of maintenance to maintain their performance level. And only an intuition-based quality improvement is not enough. So a structured program is required. So I was looking for some insight how to go about and how to do it. And FICG is actually a right fit because again, the real world application of knowledge is also there along with our schedule also actually very easy to maintain. And the course experience, and we are gone through the major pillars of framework, including audit, risk management, and everything. And we go to do an clinical audit of our choosing. So I choose breast cancer. It was our performance or the institution's performance in managing breast cancer patients. It was actually an eye opener. There are actually so many things which are way off from the standard which we have kept. And then speaking of the program, the faculty was actually very experienced and they are experienced in real life problem solving and they know the hurdles and they know how to tackle them. And they were actually open to the questions and doubts and those were actually answered in a comprehensive but precise way. And it has provided, although it's I know it's actually a very huge topic to fit into this framework, but all the necessary tools to start something that has been given and provided during the FICG program. So what impact it had in our hospital? So actually, I was sent to the program by our hospital. So there were 6 people in the program also. And so after completing the program, we constituted a clinical governance group and including all the 6 people who were actually took the program. And each tried to elaborate or try to implement something which you have learned from this thing. So many people have chosen clinical audit or one pillar of clinical governance, one department we thought to improve. And in oncology, we defined because we were well off the SOPs which were set for the patient, including tumor board discussion, how to communication level, education and information flow into the patient. These were actually, we were well off. So we thought to make a defined patient flow and a dedicated PR was appointed in our department so that the patient will go through the defined flow. And how it has helped me, actually, I knew things, something is off or some difference is there, but once I started auditing things, I had the data. So whatever I tell, that is backed by data. Okay, I have done this and this many patients have this problem and we are well off or we are better or in some way we are better than the peers or something like whatever I tell that is always backed by data. And that enabled me to participate more meaningfully in institutional quality committees and the conversations with administration became more credible. And the certification, the quality training actually gave more weight to my voice. And now I see things which are outside the clinical purview because we usually see the patient and how the treatment and we are very concerned about the treatment being delivered. But now I started thinking outside the clinical purview regarding even including the patient reported outcomes. So it's just a start, I know, and we think we would like to take it forward. And I believe in the phrase that the change always starts at home. So what I thought was we will establish a clinical governance unit in our Department of Oncology and develop it as a model for the whole hospital to follow and to mentor our juniors so that the idea goes and multiplies. And I also intend to serve as a core administrative committees also so that our voice is actually heard at the levels which matters. So I think my next, our best surgery, I will be doing on a broken system with the tools I learned from CAHO. Thank you.
Thank you, Dr. Ajay Sashidhar. That was a brilliant presentation and best wishes to you. I think it's a very proud moment for us at CAHO. We keep talking about how to get the clinicians involved. I think we are in the right direction. Listening to both you and Dr. Neeta, we are very, very positive that we are in the right direction. Thank you so much and all the very best to you.
Thank you, ma'am. Thank you.
Thank you. And we are going to be partnering for this program with NH, Narayana Hridalia. We are going to be signing the MOU very shortly, and the clinical governance participants will get the opportunity to listen to the clinical governance meetings of NH 4 centers. So now over to Qualips. Building a culture of quality and patient safety in healthcare, we have partnered with the Indian Institute of Public Health. We chose 3 participants who excelled in our Quality Olympiad and sent them for the fellowship in quality management, quality and patient safety in healthcare with the Indian Institute of Public Health. And we really thank Dr. Mehta and Dr. Apur for the support given to us. I request Pratna to kindly present her experience. Pratna?
Yeah, good evening, ma'am.
Yeah, go ahead, Pratna.
Is my slide visible?
Yes, Pratna, go ahead.
Okay. So, good evening, everybody. Is the slide show?
It is visible. Go ahead, Pratna. Make it full screen.
Good evening, everybody. I'm Pratna Nandlal Sahitya from JSS Hospital, Mysore. I have completed my MBA in Hospital Administration from JSS Academy of Higher Education and Research, Mysore. So today I'll be sharing my experience from the IIPHG CAHO Fellowship in Patient Safety. So this 3-month hybrid fellowship program focused on patient safety, quality improvement, and healthcare leadership through expert-led sessions, mentorship, and practical implementation. So my quality improvement project of the fellowship was titled by Bridging the Knowledge and Practice, where I evaluated prescription writing, audit, education, and digital dashboard innovation. So this topic was selected by me because incomplete or unclear prescriptions can affect patient safety, medication accuracy, and continuity of care. The aim of the project was to assess the adherence to prescription writing guidelines and implement interventions to improve the compliance. So this was the methodology that I followed, where in the initial phase, I did a baseline assessment using a CAP survey, using the retrospective data of last 1 year. And then we did some interventions like introducing dashboard system, doing training, and doing the post-implementation evaluation. And post that, we did a validation for the manual audit versus AI-based audit. So my implementation, the main interventions that we included were staff training sessions, introducing a 6-point prescription safety visual reminder checklist in all the OPDs, and a QR-based digital prescription audit dashboard, which was accessible to all the doctors to know their updates of the monthly prescription audit that was done. And the project showed improvement in awareness and adherence towards prescription writing guidelines. The digital dashboard strengthened monitoring and accountability within the departments. Training interventions also demonstrated a statistically significant improvement in the post-test scores, reflecting the effectiveness of the educational approach. And post all these interventions done, the post-intervention analysis also showed good results. So coming to the key learnings of my fellowship. So this fellowship enhanced my understanding of the patient safety, systems thinking, and quality improvement methodologies. I learned the importance of teamwork, communication, continuous monitoring, and data-driven interventions in creating sustainable improvements in healthcare. So in conclusion, this fellowship was a valuable learning experience that strengthened my practical understanding of patient safety and healthcare quality improvement. It provided an opportunity to, translate academic learning into real-world implementation and reinforced my commitment towards safer patient-centered care, where actually this fellowship made me think out of the box. And I don't know coding, I tried to do some dashboard implementation, and it really helped me think out of the box. And I would really like to thank the CAHO team and the IIPHG team for organizing such a great initiative. And especially I thank my mentor, Dr. Medhavadwa ma'am, faculty of IIPHG, and Dr. Sriharsha sir from JSSAHER and GS sir, HR. So I really thank CAHO for its continuous initiatives in promoting quality improvement and patient safety across the healthcare organization. And as truly said, quality health in healthcare is not just an act, but it's a culture of continuous commitment towards safer patient care. And CAHO is one such organization that trains us and builds us as the future leaders to develop a culture. So I thank the entire CAHO team and IIPHG team for this fellowship. Thank you.
Thank you, Pratana. Thank you so much. Let's listen to an expert here. We have with us Dr. Bala Venkat. We have worked very closely with Dr. Bala Venkat, and he is one person who got us the anesthetist. Literally, when we were thinking about how to get the clinicians involved, we went to Sir. And at that time, he was the president of the Indian Society for Anesthesia. And he also started the Anesthesia Patient Safety Association. And CAHO has partnered with them in several initiatives. And today, Sir is the president of the World Federation. And truly, it's a pleasure working with Sir. And I would like to listen to Dr. Bala Venkat about his experience and what we can do better to involve the clinicians in this journey. Over to you, Sir.
Thank you so much, Lallu Joseph, Madam, and the entire leadership of CAHO and the Secretariat of CAHO. If I look back on the 13th Foundation Day of CAHO, if I look back, what best has happened to this country in the last 2 decades, I would say that getting CAHO be a part of the culture of the country. My heartiest congratulations for all the pioneering visionary leadership which resulted in what CAHO is today and the journey that it has taken and the amount of challenges that you would have faced. But I think this is one single institution which is becoming probably the face of patient safety in this country. I extremely happy that we could associate and align with you. In the process, we became better. We got more from CAHO than we gave anything to CAHO. And we embarked on this journey of anesthesia patient safety. And it was so comfortable and so proactive and so progressive to align with CAHO. So any project that comes in APSA now, all our clinicians, the first thing they say is, if it's a good project, the first thing they say is, sir, we should align this with CAHO. Then this will take a good shape. So that is the credibility that this organization has accomplished. And a standard is set and you walk the talk. Thank you so much, Dr. Lallu Madam, and all the leaders of CAHO who have resulted in this happening. And I heartily congratulate you on taking the new ownership and the leadership of this organization. And in anesthesia patient safety, I'm very happy to say, just this afternoon, I returned back from the World Health Assembly, which was conducted by the World Health Organization in Geneva. And there, all the countries come in, all the member countries of United Nations are represented by the Ministry of Health. They've got few non-state actors organization, and one such organization is the World Federation of Societies of Anesthesiologists, which I'm currently now, I just taken over as the president-elect. 2 years I will serve this term and then take over as president in 2028 in Vancouver. So why I wanted to share this with you is, when I went there, I took this book on anesthesia patient safety with me, which was an initiative of CAHO with APSA, with Indian Society of Anesthesiology. And I had a meeting with the quality team in the World Health Organization. And the top 2 technical officers were there in the meeting. And I presented this book to them. And the minute they saw the book, both of them said, we know CAHO. CAHO is doing very well. So I wanted to share this happiness with you, that your work is so loud and clear that without your knowledge, you have reached places. And both of them were not Indians, and both of them technical officers working as permanent staff of WHO in the safety. And I was so happy. And I took that opportunity to tell them that we will get CAHO as a non-state actor of the World Health Organization. I think we will take this forward, madam. And I think one specialization which needs patient safety to the core is anesthesia, emergency, and critical care. I think here any mistake that is done results in significant morbidity and sometimes even mortality. And until all the stakeholders involved in patient care aligned their thoughts to anesthesia patient safety, which includes the top administration in providing the infrastructure, adequate human resources to support anesthesiologist, critical care, post-operative period, high dependency unit, it can never happen. And that is the reason why what as a professional body, which we have not been able to do, CAHO has been able to do, because you align all the stakeholders into one group and make everybody work in unison for the dream and aspirations of patient safety. And we are so happy that the program which we did, where many anesthesiologists took part, in the program that we launched on anesthesia patient safety program, a certificate course, I think everybody has given an excellent feedback, and we would start this program again. And not only that, they became better, and most of them told me that they have seen that the institution where they work changed their practices, and they're amending certain things which are very important. They were very small, trivial, but they didn't do it so long. So that's been the power of these programs and courses. We will going to do it regularly. And now we are also very happy on this Foundation Day to inform that the APSA India has joined hands with CAHO in leadership program, because when the minute the discussion came, everybody jumped in and said, if this has to be something that can happen in this country positively, CAHO has to be part of it. So on this Foundation Day, I wanted to give all the credits and accolades, and I wish that this initiative has already become like a huge banyan tree with strong roots, and I think it will climb, get more recognition, not only in this country, across the world. And I'm so happy that already you have gone global, but I think you should become one of the torchbearer organization of this world, where all the learnings here will become a lesson for several people in this world. And we should take ownership in Africa and Southeast Asia and Latin America, where they need support and help. Madam, I think under your stewardship, we should look beyond the borders, and what we are doing for this country, we should do for other nations who would need our help. And we will go through this journey, and I'm very confident that you will soon become a non-state actor in World Health Organization. Thank you so much for this opportunity, and I'm truly privileged to be a part of this 13th Founders Day celebrations. Thank you, madam.
Thank you so much, sir. You truly made the day. And listening to you and the good work that you do, we are happy that we have partnered with you, and lots to do, miles to go before we sleep and miles to go before we sleep. And I'm sure by joining hands, we can do wonders. Thank you for the support. As always, Bala sir, we look up to you for the leadership. Thank you so much.
Lallu,
thank you, madam.
Lallu, next we'll take the privilege to invite Mr. Som Mittal, who's the chairman for Patients for Patient Safety Foundation. Som sir, over to you, sir. You've been a pillar in the entire journey. So please, over to you, sir.
Thank you so much. Congratulations to all of us. And I say us because CAHO is a unique organization. I think what we have achieved in 13 years, many organizations don't do it in 30 years. And I think that's a credit to how we work. This is an organization which really involves people across. With a very small secretariat, we are able to achieve so much. And that only happens if you are an institution, not an organization. And I think CAHO is an institution. And it's also an institutional builder, because I and the team, Nagra and I think we are grateful that you helped us build Patient for Patient Safety Foundation. Everybody talks about patient safety, but the patient was always missing. You were talking between yourself about how patient safety is, how quality is, but patient was missing in this whole deal. And I think that's how the foundation came. Dr. Vijay Aggarwal, Lallu said, please form it separate from CAHO, and that's how this organization got built. And the space that you have given us is amazing. I think this engagement has helped truly get patient engagement in real terms. a partnership in real terms. In these 3 years that we have been together, we've made toolkits of patient engagement. We have had patient advisory councils launched. We've created patient-friendly hospital standards. Now we're talking about how to capture patient's voice. And this is happening not because we do it. All of you have been helping us do it. And I think that's the power. We are the ones that take it forward. Today, within this short period, we've been able to reach out to over 15 lakh households. 1,000 plus hospitals are engaging with us. Our messages go to 60,000 plus physicians, and all these numbers are growing. We are a child. There is a huge journey ahead. I would say that thank you very much, CAHO, for giving us the space and giving patients this platform to be truly integral part of the hard work that all of you do to keep us safe. Thank you very much and all the very best.
Thank you. Thank you so much, Som sir. We have with us Dr. Peter Lackman, who's the chair of our International Advisory Committee, and he advises us on how to move forward with best practices and what we can learn from other countries. Dr. Peter, over to you. You're on mute, Peter.
Hi everyone. I'm in a public space, so I'll be quick. I met up with CAHO in 2016 or 17 when I was at ISPA, so I've been there for almost all of the 13 years of the journey. So it's really pleasing for me to see the growth of CAHO and how you've developed over the years. And also when I see all the faces on the webinar, that's an indication of the impact that you're having. CAHO is more than an organization, it's a social movement, and I think that is what makes it strong. So building on the idea of a social movement to spread the ideas of heart quality and safety, I can see a big future for CAHO going forward. So as I'm in a public space, I don't want to speak too long, it'll be noisy soon, and I want to wish you well on this very momentous day. Thank you very much.
Thank you. Thank you so much, Dr. Peter. Thanks for all the support that you give to us. I now have it's a very special moment for us today. And we have with us Dr. Anup Waria, the chair of our IPC Forum. The IPC Forum has put together a beautiful white paper on strategic investments in infection prevention and control. I request him to talk a little bit about the paper, and then we'll go ahead and release the white paper for the benefit of our hospitals. Over to you, Dr. Anup.
Good evening, all. So just let me share the screen, please. Yeah, so is my slides visible?
It is.
Yes.
Go ahead.
Okay. So good evening, all. So I'll be very brief. Dr. Lallu has given me 5 minutes. I'll take 3 probably. So why this white paper was required, even though from the CEOs and the boards, they are all widely professed for IPC. The truth is IPC is underfunded. And the fact that it is underfunded probably has to do a great deal with the difference in the communication and the kind of data that is delivered to the CEOs and the boards. So we thought from a perspective of how can we translate this information about patient adverse events. When we talk about adverse events and safety events laden with emotion, how can we translate that into the language that CEOs and the boards understand, which is the financial language? So that was one of the core reasons why we tried with this. So how did we evolve this? We went straight to the leaders, the CEOs, and those who hold the purse of resources. Now, if you want to have a portion of the resources for the infection prevention, we need to understand what can convince the people who hold the purses to actually give you those resources. So we spoke with the CEOs, we spoke with 4 of them in our roundtable, understood their requirements, what they expect when somebody asks them for resources, the kind of information which they need to release those resources. And putting that together, we circulated it to our reviewers, those who again work on the ground and who face this on a day-to-day basis, we collected those inputs also. So putting together the CEO's perspective in terms of what information they need for resources allocation, and the senior infection control and nursing professionals who ask or require these resources, we consolidate this aspect and we have created this document, and we hope that this will be a go-to document for the infection control officers, hospital epidemiologists, and quality leads, so that they can prepare a proper budget and get the resources that they deserve. This is made in a very user-friendly model, so that with a ready-to-do templates, so that this process can be institutionalized. Also, this data of cost of adverse events will make the investment, or will make the spend on infection control more of an investment rather than just a cost center. Okay, so that was one of the aspect of it. Finally, we hope that this will obviously protect the patients. And while we focus on protecting the patients, we are also able to translate that how this translates or converts into organizational success also. I wish to place on record my thanks to the three of my colleagues who contributed and worked on this together with me, Dr. Jayalakshmi, Dr. Aruna Pujari, and Dr. Yamuna, who was a part of the CEO board. All the four CEOs, Dr. Ranjit Krishnan, Dr. Jepin Chawle, Dr. Palin, and Dr. Narin, who contributed from the perspective of the CEOs. Dr. Lallu and Parag, even though Dr. Parag was part of another roundtable, he sat with us half of the time and he contributed extensively with his inputs into this. And finally, all our reviewers who brought a lot of valuable inputs from the ground. And with that, I'll stop. Dr. Lallu, I think I have not taken too much of time. Just last slide for you. Just illustrating what exactly is there in this document. We have a comprehensive description of the budgeting and the budgeting components. Okay, very comprehensive, so that you can read through it. Then there is a step-by-step direction on how to develop an IPC budget. We have added annexures, and this input came from Dr. Lallu, so that there are dynamic Excels where you can just put in your hospital data, the hospital, and you get automatically the calculated cost avoidance, return on investment, etc. Finally, you have a submission ready template that you can put forward to your budgeting committee and the finance. So this is what is contained in the document. With that, I hand it back to Dr. Lallu. Thank you.
Thank you, Dr. Anup, for the leadership and the team for getting this together. Very much needed, because when we do the assessments or when we are part of our team, it is one sheet of paper that is presented as IPC budget. And all of us know it is 10% more than what it was the last year. We don't know the spending. It is just a piece of paper. So this is what it is, dear friends, and this will be uploaded in the CAHO website. And maybe by tomorrow you will receive an email, read it, go through it in detail and work on it. And I'm sure it's going to be a useful document. And within just about 3 months of formation of the IPC forum, we have a white paper for you. And that's the beauty of coming together, collaboration and networking. Thank you so much, Dr. Anup.
Thank
you. So now over to our dear friend, Dr. Aparna Jairam. Again, what have we done? In the last 1.5 hours, we've actually pulled out different things that have created impact in CAHO in the last 1 year. The CAHO diagnostic division today is almost like a mini CAHO, I should say. And the way it is run, people coming together. This year, when we announced for the CAHO governing committee membership, we had more than 50% of the applicants from the laboratory sciences. So people are attending webinars every single day. They are on autopilot mode and they are all over the country. So it's a mini CAHO for you, the CAHO diagnostic division. So I want to listen to Dr. Aparna Jairam. Give a big round of applause to Dr. Aparna Jairam and the entire team of diagnostic division. So let's listen to her as to how she's put the team together and how she's really created a movement in the diagnostic side. Dr. Aparna?
Yes. So good evening and happy birthday to CAHO. Without, Lallu has given me 4 minutes. It's very difficult, but still, I will stick to my time. I think 3 big things, what has changed. When I stepped into CAHO, I was, thanks to Shankar, and then got inspired by Dr. Vijay Aggarwal. I had a lot of vacuum in my life post SRL, lot of work, and suddenly one lab. So I decided, okay, let me utilize my time somewhere creatively. And CAHO gave me that, I think that platform where I filled my vacuum with lot of creativity. I remember resonating with Lallu when I heard her story about her organization. So my now what is it? What we did is we actually came from somewhere like 4 to 5 individuals, as Lallu said, to now 97 core team members into our diagnostic group. We actually share a vision, all of us, where we are looking at, massive driving force, where we want to every day get into, get up and see what can we do today. And we are not just growing in numbers, guys. We are also giving an impact. I told Lallu today morning that let me be in a rickshaw, bus, flight, train. We are always wanting and looking at people who share the vision of quality or who are in need of quality. So this is how we have built our journey. Basically, the this change has happened because I think one small incident which without which I don't think I'll be doing justice, is when I had a heart-to-heart talk. I don't know whether I should mention this, but a talk with Lallu last year. And there were a lot of, possibly females are known for crying even when they're happy or sad. We had some tears exchanged. And that's where the trust actually built in. And there was no apprehension whether I should do this, whether I should do that. There was so much of trust, anyways, from Dr. Vijay Aggarwal, as I fondly call him, as old, young, handsome man. But Lallu gave me that another wheel to say that AJ, okay, you go ahead. And that's how I told her, stop calling me Dr. Aparna. Let's call each other as AJ, LJ. So I think we build this whole thing into three things: is building the knowledge ecosystem. What I decided when I sat with my team of Seema madam, because she is the one who has been mentoring, I said, first, let's build a knowledge ecosystem. That's where we decided to get in mentors or advisors. This is the first time, thanks to patrons Lallu and Vijay sir, for allowing us to have officially patrons and advisors in the form of diagnostic divisions. And also, we started having IVD partners without which we cannot do anything. I think so. We have got proudly today most of them into this the webinar, Lallu. We have got Sebia, we have got Immunoshop. They are also attending, Roche, and they are so happy to do that. So we integrated our advisors and our companies to stand with us and create a powerhouse of shared knowledge. And I should thank Ashok Ratan sir, who is again one of the dynamic guys. You tell him and he's ready. I think the handbook of POCT, you will remember, protocols, webinars. We have Ravi Kumar, a dynamic guy. Everybody seems to know him wherever you go. We have Ravi Gaur. You talk of AI and he's there. We have Lokwani sir, who is like the showstopper of Madhya Pradesh. You have witnessed the event in Indore. Katot sir, Neil Kamal Kapoor. So I think that's the first thing, strengthening our educational and industry support. I wish to thank these two verticals. The second thing, what we did, which has changed this momentum into something called as tsunami, is we started having state and zonal heads, though it's there in CAHO, but we never had. And Mamta is one of the powerhouse who started. I gave that baby into her hand. I said, boss, you take care of CDs. So you will be surprised. This month we have 18 CDs. And this year we have planned 138 CDs as of today. We will not stop there. We have Ashwini, we have Manisha, Shripad, and Vidya. They are taking care of their babies, that is states. And I don't want, if I don't, actually, what Lallu did to me, I am doing to them. So we have first time Guwahati, Dr. Shabnam and Jeet. We have got Bhanu. This is the first time, everybody, we are going to have something in Chhattisgarh with Bhanu and, and the team and Manisha Mishra. We have got Piyush for medical legal. We have got Indore team rocking under Vinita Kothari's guidance. Everybody saw 2000 plus registrations. We have got our money guy, Dr. Vikas. Zubair is the young kid in the block. managing CAHO Diagnosticon. We have got Samita Nair, who just came out of somewhere and arranging 5 pre-conference workshops, white papers from ImmunoShop. So Lallu and team, we have got, as of today, 48 pre-conference workshops, still my CAHO Diagnosticon. We have got vertical heads like you gave me transfusion medicine and asked me. I think then I got hold of 2 pearls, Sangeeta and Kamini, and we are planning a big conclave apart from monthly webinars, which are hugely appreciated. My radiology department was sleeping, and I suddenly caught hold of Dr. Patkar and Dr. Pramod, who is handling it so efficiently, and we are looking forward to have a full session in Bangalore. Apart from this, after this, I said, what next? So we got a wonderful path-breaking MOU with QCI and CAHO. I think it just boosted the morale of everybody. All our team was celebrating, and that's going to be breaking the barriers across the country. And then we said, "Acha, India ho gaya. Now what?" So now we are looking at Kenya with Dr. Gikera and Dr. Sharma for the MOU for 15189 across. We are looking at Dr. Mayur and Dr. Krishna and Dr. Aarti for Qatar. They want to do something with CAP, and CAP has also extended their help. I think as we are talking, maybe next week we will be finalizing that. We have Dr. Rojan from Nepal and Bangladesh, our own Dr. Saifuddin. So our blueprint is already ready. So I think within 4 minutes, I can only say that this trajectory is incredible. It's my team, our partners, above all that trust which Lallu and I have to say Dr. Vijay Aggarwal, and I should mention Dr. Parag, though I'm a dear friend of his, but now he is the Secretary General. But I look forward to him. And Dr. Thuppil sir, I'm always there, and he's always there. Aparna, in his South Indian accent, he'll call me his daughter and hug me. Then I want to really, really thank my secretariat team. And in case I have missed anybody, Dr. Manisha, hi, thank you. I have my new team, Lallu, Dr. Surpam, who is now the kid on the block for me, but he's very senior, and Vinita Kothari. She's always there. She's a rock star. You have evidenced. And before I end, my secretariat team. So what we have done is just the beginning. Wait for the next year.
Thank you, Aparna. A true inspiration, and I'm sure the trajectory is going to be really good. Thank you so much for the support.
Thank you. Thank you.
Thank you.
Happy
So
birthday.
now I'll hand over to Dr. Parag to take us through the CEO bootcamp, and very quickly we'll listen to Dr. Reginald Alex and Dr. Rahul after that. Dr. Parag.
So thank you so much, Lallu. I think what has happened is we've started this CEO bootcamp to energize the CEOs into having new learnings. We've already done 6 across the country, and we are now being asked to do more and more across various parts of the country. Our zonal chairs are reaching out to us. I would like to have a participant to actually speak about their learnings. Shweta Sharma from Charnock Hospital. Shweta, can you please come in?
Yeah. Am I audible, Dr. Parag?
Absolutely, Shweta. Thank you. So nice to see you again. And Shweta, over to you.
Thank you. Good evening and congratulations to CAHO family. Thank you for giving me the opportunity to share my experience. As leaders, continuous learning and skill enhancements are essential part of the healthcare environment. Attending CAHO CEO boot camps in Mumbai and Kolkata was truly encouraging and experience for me. The program enhanced my strategic thinking, leadership perspective, patient safety, and organizational culture through practical learning and interactive discussion. Most importantly, it provided an excellent platform for networking and cross-learning with healthcare leaders across the world. Can I share my screen?
Sure.
Thank you. Just a second. Sorry, I think it is just yeah. So that's the beginning. There are the 2 boot camps we had attended. That's Dr. Parag, who was taking our class.
Shweta, we can't see the slides.
Okay. So just give me a second. Maybe I'll just.
Maybe if the slides are not coming on, you can just speak about your learnings. That's
Yeah.
also fine.
It's good to just speak about it, Shweta.
Just speak about it, Shweta.
Yeah,
Okay.
yeah,
Right.
it's coming. Yeah.
Right, it's coming.
Yeah, it's there.
Better?
Yeah.
I really wanted to share this. That's the reason I was taking that extra initiative.
Yeah,
So
go ahead.
yeah, so this is the bootcamp pictures I would like to put. So this is Dr. Parag, who had taken both the classes, EBITDA and financial management. And it was understanding of EBITDA in healthcare, financial planning and operational efficiency through a case study, which actually helped us to understand how we can evaluate our finances and look into the P&L areas real too. That is Dr. Lallu ma'am. Again, her insights were amazing. It was regarding the organizational culture. Sometimes we don't understand how to handle a few points. So positive work culture and accountability, trust, teamwork, and employment engagement through quiz did give us a lot of inside learning and cross learning from other activities too. That was a vision shared by Dr. Manivannan, importance of organizations because he started his career from scratch and aligning the goal with long-term growth. He was sharing all the insights, how he had grown from scratch till the largest right now in Chennai. One of the largest in Chennai, sorry. Leadership by Dr. Neil Saknera. It was amazing. It was a lot of insights, visionary and empathetic leadership, adaptability and effective communication. We had a lot of cross learning from each other with the faculties as well as with the participants. That is branding and marketing by Mr. Prashant Sharma, healthcare branding and positioning, patient-centric marketing and visibility. He did share all his 3 Ps, which were quite helpful for us to use in our marketing and branding later on. Networking and cross-learning, exchanging of the ideas and best practices, collaborative learning through the group activities, meaningful professional relationships across the organization did help us. I would like to share a short part that I had a patient who was, so CAHO had actually made a family with all the participants. Whenever I have anything, I can just reach out to Mumbai team and I can ask for help. I can take help in Hyderabad. I had patients getting down to Hyderabad and Mumbai, and there was everybody standing next to my patients and taking care of them. So thank you so much, Kaho. I will end my I will just give a short line with Dr. Mother Teresa because we are from Kolkata. So not all of us can do things, great things, but we can do small things with great love. That's why.
Thank you so much. Thank you, Shweta.
I have a
Lallu,
short
back to you.
video I would like to play because this will actually, this is specially for CAHO team, if I'm allowed. Is it visible?
Can we play in the end, Shweta? Because we
Shweta,
have
we'll
some
play it at the end. Just
play
share
at
it to
the
the
end.
secretariat. We're running a little
Done,
late.
done.
Yeah. Thank you so much.
So much.
Thanks a
Thank
lot, Dr. Shweta. Truly, it's that great love. Thank you.
Thank
Let's
you so much.
listen to Dr. Reginald Alex. He is an occupational health specialist, MD himself, and we brought the book together. Dr. Alex, your experience.
Thank you, Lalu, for the opportunity. And you gave only 2 minutes. So,
1 minute.
Yeah, 1 minute, correct. Okay. Uh, thank you for including occupational health into CAHO. I'm really thankful for this because occupational health is something which is neglected, especially in India. So I have taken this burden on my head so that the Indian system should know that this is important. And of course, CAHO has given the platform for me to project occupational health is important for the country. And of course, what we have done recently was we have published a book on occupational health in healthcare. And I would like to thank especially Dr. Lallu and the team and CAHO for allowing us to publish such a book because already it is a hit. So I am really thankful for that. And of course, we have to do a lot of work. And I may use this platform as a medium to project occupational health in this country. And thank you so much for all the opportunity. And we'll continue to work together. Thank you, Lallu. Is that okay?
Thank you.
Yeah.
Thank you so much, Dr. Reginald Alex. And truly, I think lots to achieve in this area. And let's work with the hygienists as well, not just limited to the healthcare, but also the factory inspectors and hygienists towards occupational. Thank you. Now we listen to Dr. Rahul Deshmukh, the medical director of and head of the Department of Anesthesia. From Zuleka Hospitals on strengthening healthcare through clinical governance. He was the one who started the clinical governance program for us, a super duper hit, I must say. Over to you, Dr. Rahul, on your perspective.
Thank you, Dr. Lallu. Thank you for this opportunity. Congratulations to CAHO, CAHO leadership, Vijay sir, Dr. Lallu, Dr. Parag, the entire GC, patrons, former GC members, as well as members of CAHO. CAHO is a family for all of us, and it has really, over the last 13 years, it has really grown. What happens next? How do we grow beyond what we have achieved so far? Initial growth will always be easier. Now maintaining it is going to be a challenge. And how do we go beyond just maintenance? How do we continue to be at the apex? That's going to be the key. And we always thought that to expand, we really need to look at involving clinicians and nurses. That's the way forward. That's why we just saw two prime examples of clinicians being involved. And it's not only those individual clinicians, it's their institutes which are changing. We saw Dr. Neeta as well as Dr. Ajay, really good presentations, but what was more heartening to see was the organizations are getting on board. That's the key for us. That was clinicians. Next, we are very happy. We will be starting work from next Tuesday on developing another program for nursing governance. And that again, I believe will be a game changer for us. So truly looking forward to fantastic opportunities for all of us. Wishing CAHO all the best and wishing all the leaders all the very best. Thank you once again for this opportunity.
We intrude on anyone's vacation as well, Dr. Rahul. We understand you're traveling and coming, so we took at least 16 hours of your time dedicated for
No
CAHO
problem
to
at
be
all.
with us and develop the nursing governance program. Thank you so much for accepting.
Thank you. Thank you.
Thank you. Thank you. And let's another group, which is a small healthcare organization group of CAHO, has really created the ripple, I must say. They're all over the place with their Jeevan. And Dr. Babu has become the name synonymous to Jeevan. So can I invite Dr. Babu Narayan to talk about strengthening healthcare quality through through his SHO initiative. Dr. Babu?
Sorry, madam, I was ready. Good evening, everyone. I was ready with the presentation and other things, but got late. I am driving on the driver's seat. So I will just present whatever we have done in the last few months or so. And thank you for the CAHO team for forming an SHO segment or a wing, which was really helpful for reaching out to the grassroots level of hospitals or organizations. Though we had been working in this field for the past 12 years or so, there wasn't any kind of a specific wing which is addressing to the needs of the small healthcare organization, which constitute around 65% of our healthcare system. So with CAHO's leadership and the thought process of Dr. Rai, I have to take this opportunity to thank Dr. Rai for taking all those efforts to give that initial rocket kind of push to go into the outer space, the effort and his personal commitment to it that brought SHO to the fore. We did two SHO, then we thought of we were doing in every 3 months or so to reach out to the wider number of hospitals, say 1 lakh plus hospitals, which are small healthcare organization, what we can do. So there, the learning opportunity was that how to make it economical. Previously, it was costing a little bit more than 2 or 3 lakhs. We were thinking that how can we reach? So one was the economy. We made it 1 to 1.25 lakhs, by which we could get the support because it is a small healthcare organization. Economics play a part. So there we changed a little bit so that it can be done every week. the support and the kind of enthusiasm and all the kind of inspiration and motivation gave by the CAHO leadership and the freedom to travel and take this quality journey to the small healthcare organization, because every SHCO cannot come to a major event because of finance and resource restriction. So we wanted to do or develop this healthcare resources or quality locally at that center. So that was the entire thing. So this Jeevan program, one-day conference, which was done in the tier 2 or tier 3 cities, was the major flagship event of SHCO. And I should thank the support given by Mr. Adel and Dr. Malati for taking this Jeevan program and also the Boost seminar. There are two programs which we are conducting, which we thought that it will be so useful to take it. One is the webinar kind of things where we could reach out to the wider public. And there is another one-day conference, which is a physical conference. The learnings were that there are people where the quality haven't reached, where we can really do a lot of work by taking this quality nearer to them, making it accessible. And second, it had also brought CAHO to new kind of I would say that geographical area where they could get visibility, and by which there are a lot of participants who are coming into the fold. And I personally think with the kind of program what we have done for the past few months or so, the reachability was good. And now the awareness or the snowballing effect is happening. And I'm hopeful this will continue with the continuous enthusiasm and support from the leadership team. And now we are planning to conduct 100 events in this year. And Madam has given a target as well, because to reach out to various SHCOs and one international, if God willing. Thank you very much, CAHO, for your support and the trust which you have kept on us. Thank you very much.
Thank you. I think you have given your family time to us as well. You carry on. Thank you so much. Sorry about the delay. Thanks, Dr. Babu. And last but not the least, we have excellent partnership with our industry partners. And we did a beautiful collaborative exercise with Heliard, O&M Heliard Health. And we have with us Reena George, the marketing manager of O&M Heliard Health. We completed about 25 plus events across the country along with them. Reena? Reena?
I think there was a... okay, yeah.
Yes, sir.
I don't think Reena is going to be able to join.
Yeah, that's okay. I think we can move on. So, I think we have come to the close of this day's program. And we have a very special person to acknowledge and thank. So, may I request the CAHO team to be ready? We have to talk about this person and then probably present this person our appreciation. It is celebrating 12 remarkable years of dedication, commitment, and contribution. We proudly honor Dr. Sakshi Sharma, General Manager, for her incredible 12 years of association marked by unwavering dedication, exemplary leadership, and valuable contributions. Her commitment to excellence, professionalism, and continuous support has played a significant role in the organization's growth and success. We extend our heartfelt gratitude and congratulations to Dr. Sakshi Sharma on this remarkable milestone and wish her many, many, many more years of success and achievements ahead with CAHO. Sakshi, that is with CAHO. So I remember the first day of meeting Sakshi, Dr. Aggarwal brought her to Yashoda Healthcare where we were doing a training program. A very soft-spoken person. She will measure her words and speak, but a person with perfection. You give a job to her, it will be done to the fullest, without any mistakes, any error. And that's the commitment with which our secretariat is functioning, and all our dear girls and the lovely men there at secretariat, 22 plus members of the secretariat. We thank you for what you're doing. and of course, wishing Dr. Sakshi Sharma very good, a successful career with CAHO. So may I request Sonali to kindly put up the felicitation video, and we'll obviously be giving her a surprise very soon. Vijay sir?
Hello, I'm here.
Yeah, volume please. Volume. Sonali? Sonali, the audio is not heard. Vijay sir, do you want to say something? And Parag?
Vijay sir, after you.
No, you said it all.
I would definitely like to say that I've been interacting with Sakshi when I was coming in as faculty for various CAHO cons. And she's the one person, along with all the other secretary members, of course, but she's the one person with whom I've interacted maximum. So Sakshi, thank you very much for being there and looking forward to working with you for many, many years. Congratulations on behalf of the entire CAHO family.
Sakshi, your response? She's a very shy person. Is she there, Sakshi?
Hello?
Yeah. You can turn on your video.
Ma'am, I'm not presentable.
Your face is quite presentable, Sakshi.
Always, yeah.
Good.
There. Let's give a big round of applause to Sakshi for 12 years, remarkable years of dedication, commitment, and contribution.
Thank you. I would like to say thank you to everyone. And I think I have no words to say. It was a great journey. And it is not 12 years, ma'am, 10 years actually. So you have added 2 extra years.
Thanks for correcting me.
So thank you everyone.
Thank you. Over to you, Parag. Together towards better healthcare.
So I think I'm stepping in at a time when already the shoes are very big to fill in. It's important to keep the momentum up. I think what's important to do is to ensure that we continue in the same spirit. That is point number 1. Point number 2, we have added a new vertical by way of international sort of development. We've got to go to many more countries under the leadership of Dr. Anuradha Pichumani and the entire team over there. What is extremely critical is the hiving off of the Northeast into a separate zone. I think we've got to work with the zonal chairpersons and the state chairpersons to ensure that we take quality to the absolute interiors of the 7 sisters. And what is also very critical is that, as I think Lallu already said it once before, is that the clinical piece is something that we need to get more. While we started with critical care and we've started with anesthesia, I think the burden is on Dr. Suvin and team to work under the healthcare professional divisions to expand this and to ensure that we get more and more clinical experts coming in. The day is not far when quality will less be seen as the domain of the quality specialist and the CEO, and more be seen as that of the qualitist who is present in each and every person in terms of the clinical specialists, the nurses, etc. So I think our work has been carved out well. The ethos has been set. The ethical fabric is very strongly embedded. And I look forward to ensuring that we continue with the same speed. Thankfully, we have the leadership intact, so to speak. I'm just addition, and I will ensure that we all work towards getting really ahead. We've got CAHOCon coming up in Mumbai, so that's an additional responsibility to the Maharashtra and Gujarat teams. We look forward to welcome you all for Acri Health to Mumbai. We look forward to seeing you in AMTZ for CAHO Tech, and of course for SATCon in Delhi. And of course, AMCHI Mumbai looks forward to welcoming you for CAHOCon 2027. Thank you very much, Gyani sir, for this opportunity, Vijay sir for your blessings, and Lallu sir for Lallu ma'am for the continued support. Thank you, CAHO. And with that, we'd like to close today's proceedings with the final word coming in from President Madam. Lallu, back to you.
Thank you. Thank you so much indeed. It's a pleasure having all of you with us. 2 hours of program, 2 hours. Certainly, it's not enough for the quantum of work and the time and dedication by 260 plus professionals giving their time to serve in the governing committee of CAHO, along with more than 70,000 professionals that we are connecting in India and across the globe. Thank you so much. This is a movement. We have a lot of things to achieve together. And we have a program that's coming up at IIM Shillong. If you wish to join that program, registration is open till this evening. Kindly register, and I request all of you to participate in all CAHO programs, be part of this movement, and be a champion of empowering our patients. Thank you so much. Have a great evening and a wonderful weekend. Let's celebrate the movement. Let's celebrate togetherness. Let's celebrate dedication, and let's celebrate all of us.
And let's CAHO.
Let's CAHO. Let's put up the CAHO anthem and CAHO. Looking forward to meeting all the governing committee members at Goa.
Thank you.
Photo. Peak.
Photo. Yes, please.
Photo. Yes.
Videos. Yes.
Yeah.
Thanks, Supam sir.
Yes.
Thank you, everyone.
Thank you. Thanks,
Thank you, ma'am. Thank you, sir.
Thank you.
Thank you.
Thank you.
Thank you, ma'am.
Thank you so much.
Congratulations, ma'am, once again.
Thank you.
Vijay sir,
Congratulations.
Thank you.
Congratulations to all of you.
Thank you. Bye-bye.